Silver fillings with mercury were traditionally done due to their increased strength and durability. However, with the advancements in technology, tooth-colored resin or composite fillings can provide similar strength and have the added advantage of improved aesthetics. Your dentist may recommend the replacement of your silver fillings with white aesthetic fillings. The procedure is simple. The dentist uses a dental drill to remove the old silver filling. A tooth-colored filling material, also known as a white filling, is placed into the tooth. White filling materials are actually bonded to the tooth and provide strength and stability. The filling is cured using an ultraviolet light. The cured material provides strength for chewing and function. Once the material is cured, it is adjusted and polished by your dentist using dental burrs and polishing pastes. The filling blends into the tooth, providing an aesthetic result. Tooth-colored or white fillings help to restore the tooth to its natural shape and appearance.